Let's be real, a cancer diagnosis is an overwhelming journey. Your focus is and should be 100% on the treatment plan your doctors have laid out. But once you have that plan, it's only natural to ask yourself, okay, what else can I do? What does the science say about how I can support my body through this fight? And that's exactly what we're going to dig into today.
So that's the big question, right? We're going to look at what the peer-reviewed research says about some of these unseen allies, things that studies suggest could partner with your medical care. Now, just so we're crystal clear, this is about information, not advice. It's about giving you the knowledge to feel more empowered on your own health journey. All right, our first stop, you might not see this one coming, vitamin D. Yeah, we all know it's important for bones and all that, but a ton of new research is showing this incredible connection to cancer outcomes. And for head and neck cancer, the data is pretty jaw-dropping. Let's just put this number up here for a second. 40%. I mean, wow. A study found that patients with higher levels of vitamin D had a 40% improved survival rate. That is a huge figure, so let's break down exactly what that means. So where does that massive 40% number come from? Well, it was specifically seen in patients whose tumors were HPV negative. And that's a really big deal because that group makes up about 3/4 of all head and neck cancer patients. But here's the kicker. Fewer than 10% of patients actually have enough vitamin D when they get diagnosed. So it's a really widespread issue. Okay, our next potential ally comes from a place you'd probably never expect. The world of repurposed drugs. We're talking about statins. Yep, the same exact drugs that millions of people take to lower their cholesterol. But it turns out, new research is showing they might have a surprising second job in cancer care. And check this out. This chart really lays it out pretty clearly. One study found a 30% improvement in survival for patients who started taking statins after they were diagnosed. But this is where it gets absolutely fascinating. Look at that second bar. For people who were already on statins and just kept taking them, that improvement could jump as high as 70%. And if we zoom in on a specific type, a clinical trial using lovastatin during radiotherapy showed a 40% jump in overall survival. What's wild is that the natural source of lovastatin is something called red yeast rice, which is a supplement you can find pretty much anywhere. All right, for our third example, we're looking at another medicine cabinet staple, aspirin. But this is where the science gets incredibly precise. It seems the benefits aren't for everyone. Instead, they're really targeted to patients whose tumors carry a very specific genetic flag. And that flag is called a PIK3CA alteration. The easiest way to think about it is like a little genetic marker that pops up on the tumor cells. And it's not super rare either. It's found in about 1/3 of all head and neck cancer patients. Now, for this specific group, the one with that genetic flag, the impact of something as simple as low-dose aspirin is just staggering. The research shows an almost 3-fold improvement in overall survival. 3 times. It's a pretty powerful glimpse into how personalized supportive care could work. So let's put that into perspective, because this is what's so incredible. On its own, having that PIK3CA alteration is actually linked to a poorer prognosis. It's not a good sign. But then you introduce regular use of NSAIDs like aspirin, and look what happens. Their outlook doesn't just get a little better, it's tied to a nearly 3 times better survival rate. So we've talked about vitamin D, statins, aspirin, but honestly, we're just scratching the surface here. These are just 3 examples from a much, much wider field of research. Scientists are looking at all sorts of other factors, so let's just take a quick peek at a few more. I mean, just look at the numbers for some of these key minerals. They're mind-boggling. In one study on laryngeal cancer, higher selenium levels were linked to a tripling of survival rates. And for zinc, in a similar group, a more than 2-fold increase. You know, these aren't small changes. This is big stuff. And the research is also going into these really fascinating new areas, like your gut. Can you believe it? Studies are finding that having certain types of bacteria in your gut is linked to a 3 times longer overall survival, and simple things like walnuts and oats might help them grow. Plus, there's a huge focus on managing inflammation, with things like curcumin and astragalus being actively explored. Okay, we've looked at all this amazing science, but this next part, this is the most important part of our entire conversation today. What in the world do you do with all of this information? The goal isn't self-treatment. The goal is empowerment, especially when you talk to your medical team. Because at the end of the day, that's what this is all about. This is the whole mission.
The reason we share this kind of research is to give you the tools and, frankly, the confidence to have a more engaged, more active conversation with your oncologist about your total care plan.
So I have to say this, and it's super important. None of what we talked about is medical advice. Please think of this as a community resource. It's a bridge to connect you with the science so you can bring smart, informed questions to the one person who knows your case best, your doctor. So where do you go from here? It really boils down to a simple 3-step game plan. Step 1, learn. Take in what we've talked about today. Step 2, prepare. Think about the questions that came up for you. And step 3, the most important one, partner. Partner with your doctor to build the absolute best care plan for you.
Because that's what this kind of information does, right? It opens doors. It starts conversations. So after seeing what the research is uncovering, the real question I want to leave you with is this. What new conversation are you going to have about your care?